Peripheral neuropathy refers to damage of the peripheral nerves, which are the nerves outside the brain and spinal cord. Affecting about 1% of adults worldwide, this condition can range from mild numbness in the toes to severe symptoms that may require a wheelchair. The symptoms depend on which nerves are affected, sensory, motor, or autonomic, and can include pain, tingling, weakness, or even problems with blood pressure and digestion. Understanding what peripheral neuropathy is lays the foundation for recognizing its impact on daily life and why early diagnosis is so important. Peripheral neuropathy is a global health concern, affecting approximately 1% of adults. Its prevalence increases with age, impacting up to 10% of people over 60. Diabetes is the leading cause, with over 206 million people worldwide affected by diabetic neuropathy. In low-income countries, infectious diseases like leprosy and HIV are more common causes. The burden of peripheral neuropathy is significant, often leading to disability and reduced quality of life, especially as populations age and chronic diseases become more widespread. Most cases of peripheral neuropathy are length-dependent, meaning symptoms start in the longest nerves, usually the toes, and progress upward. This type, also called distal symmetric polyneuropathy, is typically symmetric and affects sensory nerves more than motor nerves. Patients often notice numbness, tingling, or pain in their feet first, which may slowly move up the legs and in advanced cases to the hands. Understanding this pattern helps clinicians distinguish typical neuropathy from other nerve disorders. Peripheral neuropathy can affect three main types of nerves: sensory, motor, and autonomic. Sensory symptoms include numbness, tingling, burning, and pain. Motor symptoms involve muscle weakness, atrophy, and sometimes twitching. Autonomic symptoms can be more subtle, such as dizziness when standing, dry mouth, digestive issues, or problems with sweating. Recognizing the variety of symptoms is crucial for accurate diagnosis and management. Diabetes is the most common cause of peripheral neuropathy, responsible for up to 50% of cases in Western countries. High blood sugar damages nerves over time, leading to symptoms like pain, numbness, and weakness, especially in the feet. Diabetic neuropathy can also cause autonomic symptoms, such as dizziness and digestive problems. Managing blood sugar is key to preventing and slowing the progression of neuropathy in people with diabetes. While diabetes is the leading cause, peripheral neuropathy can result from many other factors. These include excessive alcohol use, vitamin deficiencies, especially B12 and thiamine, certain medications like chemotherapy drugs, hereditary conditions such as Charcot-Marie tooth disease and monoclonal gammopathies. In some cases, no clear cause is found even after thorough testing. Identifying the underlying cause is essential for targeted treatment. Hereditary neuropathies, such as Charcot-Marie tooth disease, are genetic disorders that affect both sensory and motor nerves. These conditions often present in childhood or adolescence and can cause muscle weakness, atrophy, and foot deformities like high arches or hammer toes. Pain is usually less prominent than in acquired neuropathies. Family history is a key clue, and genetic testing can help confirm the diagnosis and guide management. Certain medications can cause peripheral neuropathy, especially chemotherapy drugs like paclitaxel, vincristine, and cisplatin. Other drugs, such as some antibiotics and heart medications, may also be responsible. Symptoms often appear during or after treatment and can persist for months or even years. Dose adjustments or switching medications may help, but in some cases, nerve damage can be permanent. Deficiencies in vitamins, especially B12 and thiamine B1, can lead to peripheral neuropathy. B12 deficiency is more common in people with poor absorption, such as those with gastrointestinal disorders or after bariatric surgery. Thiamine deficiency, often seen in chronic alcohol use or malnutrition, can cause a severe neuropathy known as beriberi. Early recognition and supplementation are crucial to prevent permanent nerve damage. Chronic alcohol use is a well-known cause of peripheral neuropathy. Alcohol can directly damage nerves and also lead to vitamin deficiencies that worsen nerve health. Symptoms often include pain, numbness, and weakness, especially in the feet and legs. Reducing or stopping alcohol intake is essential for managing and preventing further nerve damage. Monoclonal gammopathies are abnormal proteins in the blood that can damage nerves. These are more common in older adults and can be associated with conditions like multiple myeloma or Waldenstrom macroglobulinemia. Symptoms may include pain, numbness, and sometimes autonomic issues. Diagnosis involves blood tests, and treatment focuses on the underlying plasma cell disorder. Neuropathies are caused by autoimmune or inflammatory conditions, such as chronic inflammatory demyelinating polyneuropathy, CIDP, or vasculitis. These conditions can progress rapidly and may cause severe weakness, pain, and autonomic symptoms. Early recognition and treatment with immunosuppressive medications can halt progression and sometimes improve symptoms. Peripheral neuropathy results from damage to sensory, motor, or autonomic neurons. This can occur through direct injury to the axon, demyelination, or dysfunction of Schwann cells, which support nerve health. Chronic conditions like diabetes cause damage through metabolic, vascular, and inflammatory pathways. Understanding the underlying mechanisms helps guide treatment and research for new therapies. Sensory nerves are often affected first in peripheral neuropathy. This is partly because the longest nerves, which reach the toes and fingers, require the most metabolic support and are more exposed to systemic factors like high blood sugar or toxins. The blood-nerve barrier in sensory ganglia is also more permeable, making these nerves more susceptible to damage. Patients with peripheral neuropathy often report numbness, tingling, or burning sensations in their feet and hands. As the condition progresses, symptoms may move up the legs and arms. Some experience stabbing or electrical shock-like pain, while others notice muscle weakness or problems with balance. Autonomic symptoms, like dizziness or digestive issues, may also occur, especially in diabetic neuropathy. Thorough physical exam is essential for diagnosing peripheral neuropathy. Clinicians test sensation starting at the toes and fingers, moving upward to find where normal sensation returns. They assess vibration, proprioception, light touch, pinprick, and temperature. Motor testing checks for muscle weakness and atrophy, especially in the feet and hands. Reflexes, particularly at the ankles, are often reduced or absent in length-dependent neuropathy. Not all neuropathies follow the typical pattern. Atypical features include rapid onset, severe motor weakness, prominent autonomic symptoms, asymmetry or involvement of other organs. These signs may indicate an immune, infectious, or neoplastic process and require urgent referral to a specialist. Early recognition of atypical presentations can lead to timely treatment and better outcomes. Laboratory tests help identify the underlying cause of peripheral neuropathy. Key tests include blood glucose, for diabetes, serum B12 and metabolites, and serum protein electrophoresis with immunofixation, for monoclonal gammopathies. Additional tests may be needed based on clinical suspicion, such as copper levels or genetic testing for hereditary neuropathies. Electrodiagnostic studies, including nerve conduction studies, NCS, and electromyography, EMG, are valuable tools for diagnosing peripheral neuropathy. These tests help distinguish between axonal and demyelinating neuropathies and can identify other conditions that mimic neuropathy, such as nerve compression or radiculopathies. NCS typically show sensory nerves affected before motor nerves in length-dependent neuropathy. Skin biopsy is a specialized test used to diagnose small fiber neuropathy, which affects pain and temperature sensation. A small sample of skin is taken and examined for nerve fiber density. Reduced density confirms the diagnosis, but the test has limitations, including variability between laboratories. Skin biopsy is most useful when symptoms are limited to pain and temperature changes. Autonomic testing is reserved for patients with prominent autonomic symptoms, such as dizziness, digestive issues, or abnormal sweating. Tests include the quantitative pseudomotor axon reflex test, which measures sweating, and cardiovagal testing, which evaluates heart rate response to deep breathing. These tests help confirm autonomic neuropathy and guide management. Risk of developing diabetic neuropathy increases with longer duration of diabetes, older age, higher blood sugar, HbA1c, obesity, and high cholesterol. Early symptoms often include pain and numbness in the feet, sometimes accompanied by metabolic syndrome. Managing these risk factors is crucial for prevention and slowing progression. Rare but important form of diabetic neuropathy is treatment-induced neuropathy, which can occur after rapid correction of high blood sugar. This condition causes acute, severe pain and autonomic symptoms within weeks of a significant drop in HbA1c. Gradual improvement of blood sugar is recommended to avoid this complication. Inflammatory diabetic radiculoplexus neuropathy is a rare but severe form of diabetic neuropathy. It presents suddenly with unilateral pain, weakness, and muscle atrophy in the thigh and hip, often accompanied by weight loss. Early recognition and specialized treatment are essential for improving outcomes in these patients. Vitamin B12 deficiency can cause a neuropathy that often includes sensory loss, tingling, and ataxia. It is more common in people with poor absorption, such as those with gastrointestinal disorders or after certain surgeries. Treatment involves B12 injections or high-dose oral supplements, which can prevent progression if started early. Thiamine vitamin B1 deficiency leads to beriberi, which can present as neuropathy or heart failure. Neuropathic beriberi often involves cranial nerves and can mimic other neurological disorders. High-risk groups include those with malnutrition or chronic alcohol use. Thiamine replacement is essential and should be given before glucose in suspected cases. Both deficiency and excess of vitamin B6, pyridoxine, can cause neuropathy. Deficiency is often due to certain medications or malabsorption, while toxicity usually results from high-dose supplements. Symptoms include sensory loss and ataxia, which may be irreversible if not addressed promptly. Supplementation should be tailored to individual needs. Copper deficiency is a rare but treatable cause of neuropathy, often presenting with sensory ataxia. It is associated with malabsorption or excessive zinc intake. Diagnosis is confirmed by blood tests, and treatment involves copper supplementation, which can lead to improvement if started early. Chemotherapy-induced peripheral neuropathy, CIPN, is a common side effect of cancer treatment, especially with drugs like paclitaxel, vincristine, and cisplatin. Symptoms are usually sensory and can limit the amount of chemotherapy a patient can receive. While some patients recover after stopping the drug, symptoms may persist for years in others. Hereditary transthyretin amyloidosis is a genetic disorder that can cause length-dependent sensory neuropathy with prominent autonomic symptoms. New treatments, such as medications that stabilize or reduce transthyretin, have shown promise in improving symptoms and quality of life for affected patients. Managing sensory symptoms such as numbness and pain is a key part of neuropathy care. Patients should inspect their feet daily, wear well-fitting shoes, and avoid injuries. For those with diabetes, podiatric care is especially important to prevent ulcers and infections. Education and self-care are vital for reducing complications. Neuropathic pain can be challenging to treat. First-line medications include gabapentin, pregabalin, duloxetine, and amitriptyline. Topical treatments like lidocaine or capsaicin patches may help some patients. Combination therapy with drugs from different classes can provide added benefit. Opioids are not recommended for neuropathic pain due to limited efficacy and risk of dependence. For patients with persistent neuropathic pain, advanced therapies like spinal cord stimulation may be considered. This involves implanting a device that delivers electrical impulses to the spinal cord, altering pain signals. While not suitable for everyone, it can provide significant relief for some patients with severe, treatment-resistant pain. Physical therapy can help patients with mild weakness improve gait and balance, reducing the risk of falls. Occupational therapy is useful for those with hand weakness or difficulty performing daily tasks. For severe motor impairment, assistive devices like foot orthoses, walkers, or wheelchairs may be necessary to maintain independence. Some patients with peripheral neuropathy develop foot deformities or contractures that require orthopedic intervention. Surgery may be needed to correct severe deformities, while custom orthoses can help prevent further complications. Early referral to orthopedic specialists can improve mobility and quality of life. Prognosis for peripheral neuropathy depends on the underlying cause. While some forms, like those due to vitamin deficiencies or certain immune conditions, may improve with treatment, complete reversal of nerve damage is uncommon. Many patients experience persistent symptoms, but early diagnosis and management can prevent progression and improve quality of life. Living with peripheral neuropathy can be challenging, but many people find ways to adapt. Support from healthcare providers, family, and community resources is important. Lifestyle changes, such as regular exercise, healthy eating, and avoiding alcohol, can help manage symptoms and improve overall well-being. Prevention focuses on managing risk factors, such as controlling blood sugar in diabetes, avoiding excessive alcohol, and ensuring adequate nutrition. Regular checkups and early intervention for symptoms can help catch neuropathy early, when treatment is most effective. Education and awareness are essential for prevention. Research into peripheral neuropathy is ongoing, with new treatments and diagnostic tools being developed. Advances in genetic testing, biomarkers, and targeted therapies hold promise for more personalized care. Continued research is essential to improve outcomes and find cures for the many causes of neuropathy. If you experience rapid onset of symptoms, severe weakness, or autonomic problems, it's important to see a neurologist or other specialist promptly. Early referral can lead to more accurate diagnosis, timely treatment, and better outcomes, especially for atypical or rapidly progressing neuropathies. Support groups, educational materials, and rehabilitation services can help patients and families cope with peripheral neuropathy. Connecting with others who have similar experiences can provide emotional support and practical tips for daily living. Healthcare teams can guide patients to appropriate resources. Peripheral neuropathy is a complex condition with many causes and a wide range of symptoms. Early diagnosis and targeted treatment can improve quality of life and prevent complications. Managing risk factors, staying informed, and seeking support are essential steps for patients and families. Experts recommend a comprehensive approach to peripheral neuropathy, including careful evaluation, laboratory and electrodiagnostic testing, and individualized treatment plans. Collaboration between primary care, neurology, and other specialties ensures the best outcomes for patients. As our understanding of peripheral neuropathy grows, so do the options for diagnosis and treatment. With ongoing research and new therapies on the horizon, there is hope for better management and even prevention of this challenging condition. Staying informed and proactive is the best way forward. Peripheral neuropathy affects millions worldwide, causing a range of sensory, motor, and autonomic symptoms. While diabetes remains the most common cause, many other factors can contribute. Early diagnosis, risk factor management, and a multidisciplinary approach are key to improving outcomes and quality of life for those affected.